Hey, pet parents. Today I want to talk about something that scares a lot of dog parents that are caring for a dog with valley fever. And honestly, it scares a lot of veterinarians too. We're going to talk about elevated liver enzymes in dogs with valley fever, especially when those enzymes go up after the dog starts antifungal medication like fluconazole. So here's the typical scenario. The dog gets diagnosed with valley fever. Blood work gets done, and the liver enzymes are already elevated, which is actually not unusual in a sick dog with a serious fungal infection. And then the dog gets started on fluconazole, and a few weeks later, the blood work is rechecked, and the liver enzymes are higher. Sometimes a little higher, sometimes a lot. And sometimes they're so high that the pet parent is terrified and the veterinarian is uncomfortable continuing the medication. So the big question becomes, what do we do now? Do we stop the fluconazole? Do we reduce the fluconazole dose? Do we switch drugs? Do we add liver support? Do we blame the medication? Do we blame valley fever? Do we blame the supplements? The answer is it depends. And this is one of those situations where context matters. The first thing I want you to understand is that elevated liver enzymes do not automatically mean liver failure. That's really important. Liver enzymes are markers. They're markers of liver stress, inflammation, bile flow issues, medication side effects, or even the infection itself. But by themselves, they do not always mean the liver is failing. That doesn't mean we ignore them. We absolutely do not ignore them. But we also don't need to lose our minds every time ALT or ALP goes up. We need to interpret the numbers in the context of the whole dog. Is your dog eating, vomiting? Are they yellow or jaundiced? If you look at the whites of the eyes or the gums. Is the bilirubin elevated? Is the dog losing weight? Is it lethargic because of liver disease, or is it lethargic because it has valley fever? Is the dog improving, even though the enzymes are higher? These are the questions that matter and determine which way we go with things. A lot of dogs with valley fever already have elevated liver enzymes before they even start fluconazole. So when I see elevated liver enzymes in a dog with valley fever, I'm not only thinking about fluconazole that's irritating the liver. I'm also thinking, is the valley fever itself driving inflammation in that dog's liver? Maybe. And that distinction matters because if the infection is contributing to the liver inflammation or the elevation in the liver enzymes, then stopping antifungal therapy without a strong alternative plan may make everything worse. The infection gains ground, the dog gets sicker, and the enzymes may not improve because the underlying infection is still there. Now, let's talk about the conventional approach, because this is what most pet parents experience. Usually the dog is started on fluconazole. It's the most commonly used antifungal for valley fever. It's affordable, it penetrates tissues well, and it's the first choice, especially if there's any concern about nervous system involvement, like brain or spinal cord or nerves. But it still has to be processed by the body, and in some dogs, it can contribute to elevated liver enzymes. When enzymes go up, a conventional vet will add denamirin, a liver support supplement. So the Denameron contains SAMe, which is an antioxidant, and silibin, which is just one active constituent of milk thistle. So I don't hate Denameron. I actually think it's quite useful. And lately, I actually have been seeing more vets start Denameron right away when a dog is diagnosed with valley fever and placed on fluconazole instead of waiting for the enzymes to go up. And honestly, I think that's a great idea. But here's where I differ. Denameron is not the same thing as milk thistle. Silibin is just one chemical constituent, and it's useful, but the whole herb of milk thistle contains dozens, sometimes hundreds of compounds that work synergistically. So I add real milk thistle when I'm working with a dog that has elevated liver enzymes, even if that dog is already on Denameron, because combining the two works better than relying on Denameron alone. Let me show you the product I recommend. So this is the natural path version of milk thistle. It's a glycerate, so it doesn't taste horrible. Yeah, and fairly easy to give. So by adding the whole herb milk thistle that's processed to the Denameron, you get a broader, more complete approach. And that's a simple tweak. Now, if the enzymes keep climbing, the next conventional move is often to switch antifungals. So that can make sense. If the dog is clearly not tolerating the fluconazole, we need other options. But the choice of antifungal matters. Sometimes vets will switch to itraconazole, which can be a good antifungal in certain situations, especially in bones and joints, but it can actually be harder on the liver. So if that's the whole reason we're switching, is that the liver is struggling, I'm not really excited about itraconazole as the next move. In more complicated cases, if we truly need to move away from fluconazole, I'm more interested in drugs like posaconazole or voriconazole, depending on the dog. And it also depends on the location of their infection, the dog's symptoms, and posaconazole and voriconazole are broader spectrum, and they can be super helpful in difficult valley fever cases. They're also kind of expensive, but from a liver standpoint, they may be a better choice than simply switching to itraconazole in a dog whose liver is already pretty unhappy. This is why I don't like cookie cutter medicine for valley fever or really for any chronic disease. You can't just say every dog gets fluconazole, every dog gets Denameron if the enzymes rise, and every dog gets itraconazole if that fails. You have to look at the whole dog. You have to look at the severity of the infection, the liver values, whether the dog is improving, whether there are signs that maybe the valley fever has disseminated or spread throughout the body. So it depends, right? So let's talk about supplements, because this is where I see a lot of vets throw the baby out with the bathwater. A dog comes in with elevated liver enzymes and the vet says, stop all supplements. Then the dog relapses or worsens because it lost the immune support that was helping it fight the valley fever, and then everybody acts surprised. This drives me crazy. Professional quality supplements are not harmful to the liver. Many are protective. Milk thistle, medicinal mushrooms, antioxidants, omega-3 fatty acids, and a lot of Chinese herbal formulas can be part of why the dog is holding its own. Valley fever is an immune system disease just as much as it's a fungal infection, and these dogs need immune support, nutritional support, anti-inflammatories, antioxidants, liver support, the whole thing. And taking everything away because the enzymes went up is not automatically the safe thing to do. And here's the thing. 99% of conventional vets, including specialists, are not veterinary herbalists. So my advice is, if a certified veterinary herbalist prescribed herbs and supplements for your dog, they should be the one deciding whether to change or discontinue those supplements and herbs, not a veterinarian with zero training in herbal medicine. So with that said, there is one supplement I pay very close attention to when liver enzymes are elevated, and that's CBD. CBD can increase liver enzymes in some dogs. I'm not saying it's bad or can never be used, but if I have a dog with valley fever with climbing liver enzymes and that dog is on CBD, I'll often stop the CBD for a while and see if it helps. And I'll recheck those liver enzymes and see if they go down with just that change. And this matters because many pet parents add CBD on their own for pain, anxiety, sleep, appetite, and they forget to mention it because they think it's harmless. CBD is fabulous, but it's biologically active and it can interact with drug metabolism. And in some dogs, it contributes to enzyme elevations. So it's one of the first things I want to know about. Now let's get into the really difficult cases. Sometimes liver enzymes go up and up and up on fluconazole. The medication is changed and they still go up, or the dog can't tolerate any pharmaceutical antifungals without the liver becoming a major problem. We've stopped CBD, maybe we've added liver support, we've looked at the diet and modified that. We've checked other medications like NSAIDs and prednisone, which can increase liver enzymes also. And we're still stuck with a dog that needs valley fever treatment, but has a liver that won't tolerate the standard drugs. So what do we do? In some of these cases, I've treated valley fever strictly holistically, but I want to be extremely clear about what that means. This is not sprinkling a supplement on the food and hoping for the best. Valley fever can be fatal. If you're going to take a holistic route because the dog can't tolerate pharmaceuticals or pharmaceutical antifungals, you have to go all in. You need an aggressive, layered, intentional protocol. You need to repeat titers, monitor blood work, track symptoms, and support the immune system, support the liver, support the gut, and support the whole dog. So this is where integrative medicine is so valuable, because we're not just asking what drug kills the fungus. We're asking what this dog's body needs in order to survive this infection and recover. The foundation is food. I know I say this all the time, but it matters. These dogs need a fresh food diet. If a dog is trying to fight a severe fungal infection, recover from inflammation, tolerate antifungal medication, and heal the liver, then feeding an anti-inflammatory or feeding an inflammatory, ultra-processed, high-starch diet is really contributing to the problem. Kibble is not the foundation I want for any dog, let alone one with valley fever and elevated liver enzymes. The immune system, the liver, the gut, all need real nutrients. And herbs and supplements work better when they're not fighting against a daily inflammatory diet. Food is part of the treatment plan, not an afterthought. Now, the next piece is antifungal herbs. When I can't use pharmaceutical antifungals or I need to reduce the dose of them, I use herbs that have fungicidal activity, meaning they are lethal to fungal cells. And this is different than fluconazole, which is fungistatic. Fluconazole doesn't directly kill the fungus the way people think. It slows the fungal growth so the immune system can gain control. And that means the immune system has to do the heavy lifting. And this is one of the biggest misunderstandings in valley fever treatment. Pet parents think the fluconazole is doing all the work. It isn't. The dog's immune system has to finish the job. So whether we're using fluconazole or another azole, herbs, or a combination, we have to support the immune system. If we don't support the dog's terrain, we're missing a major part of treatment. So this is where things like medicinal mushrooms are super helpful. And I use them in all my valley fever patients. And I'm talking about the high quality products, medicinal mushrooms that modulate immune function and are tailored to the individual dog, because different mushrooms have different strengths, meaning they work better in certain organ systems. So one mushroom will be better for lung issues, and another mushroom will be better for bone issues or neurological issues. So it depends on the dog. So a dog with valley fever needs better immune surveillance and resilience, and mushrooms are an important part of that. I also use antioxidants. Valley fever creates a lot of inflammation and oxidative stress. The antifungal drugs, the liver inflammation, a poor appetite, weight loss, all add stress. And antioxidants help protect tissues, including the liver. In serious chronic infections with valley fever or with any chronic disease, this is part of how we protect the dog while fighting the infection. The next thing we do is we use liver-specific herbal formulas. And this is where it gets a little bit more complicated, because there isn't one liver formula for every dog. Conventionally, elevated liver enzymes lead to the same recommendations, right? Add denamirin, change the drug, stop supplements, monitor. But in herbal medicine, we ask what pattern is present in the dog. And some liver formulas are cooling and anti-inflammatory. And I think of these as putting an ice pack on the liver. We calm down the inflammation and we help the dogs where the liver is inflamed and reactive. But not every dog needs that. Sometimes the liver doesn't need to be cooled as much as it needs better circulation. And sometimes elevated liver enzymes relate to liver congestion or poor flow. And in these cases, that the cooling approach won't work. The liver needs better circulation and better bile flow. This is why I can't just give one formula for all dogs with valley fever that have high liver enzymes. The right formula depends on the dog's presentation and symptoms, whether the dog is hot or cold, are they weak or are they strong, how's their appetite, are they nauseous, are they restless, are they depleted, maybe dry. These details matter. And sometimes we have to trial treat. We have to make the best decision based on the dog's pattern and then watch the response. If the enzymes improve, great. If they get worse, we may need to do the opposite. We need to do the opposite strategy. And this is where experience matters and knowing when to keep going and when to pivot. It's the same thing in conventional medicine with like antifungals and antibiotics. It's just more nuanced. There are also stronger herbal approaches for liver inflammation or hepatitis. And one common herb used in these cases is Artemisia. But again, I prefer formulas over the single herbs. In a formula, we have synergy. Let me show you Artemisia. I did a video a few weeks ago on Artemisia, but here are some products because you definitely can use Artemisia with these guys. But in a formula, Artemisia is a single herb, and when we use a formula, which is a group of herbs put together, we have synergy. So all the herbs support each other and buffer each other, and the combination improves how the formula works. And a lot of times reduces side effects, which is a bonus. Herbs are smart. So a formula isn't a random pile of plants. It's a strategy, and it has a direction and a purpose. And that's why I'm cautious about pet parents just grabbing liver supplements off the internet and throwing them at their sick dog, because the wrong herbal formula or the wrong herb at the wrong time may not help and can sometimes make the dog feel worse. One of the formulas I reach for all the time is my canine valley fever support tincture. And I use it basically in all my valley fever patients because it's designed to help fight the fungal infection while also supporting the dog. Let me put up that QR code for you so you can get more information on it. So the canine valley fever support tincture contains herbs with fungicidal activity, meaning it kills the fungal cells. But it's not just antifungal. It also contains herbs that control inflammation, antioxidant herbs, immune stimulant herbs, hepatoprotective or liver supportive herbs. And that matters because these dogs need a full body approach. They need the internal environment or the terrain to become less hospitable to the fungus and more supportive to healing. So I always reach for this tincture in dogs where I can't use pharmaceutical antifungals or where the pet parent doesn't want to. And when a pet parent doesn't want to use pharmaceuticals, it's usually not because they're being unreasonable. It's usually because they've had a bad experience or their dog got really sick from the medication or from the pharmaceutical. Or maybe the liver enzymes became a serious problem and they're just scared to put their dog back on a pharmaceutical. And I get that. But if we're not using pharmaceuticals, we need a serious plan. We cannot be casual about valley fever. Now, another area of helping those liver enzymes come down is liver detox. And this is another area where people get into trouble. Sometimes a liver detox is very helpful. The liver may need help clearing inflammatory debris, medication burden, and metabolic waste. But detox is not always the first move. So you can't really take a very sick, weak, depleted dog and throw a strong detox formula at him and expect miracles. It'll almost always backfire. The dog has to be strong enough to handle the detox. Detox takes energy and requires the liver, kidneys, gut, lymphatics, the immune system, all to have enough capacity to move things out. And if the dog is too weak and too nauseous and too unstable, detox can make it worse. So often, before a true liver detox, I want to strengthen the dog first. I want the dog eating better, the gut working better, the dog more stable. And then, when the dog is ready and strong, we may add a gentle detox. So timing matters. And a strong detox is not always better. And detoxing early is not always better. So the bottom line is, my preferred approach is integrative. I use conventional antifungal medication, but I also support the immune system, the liver, the gut. I address the diet, I reduce inflammation, and I support the dog's internal environment or terrain. I'm not anti-conventional medicine. I'm anti-failure. If fluconazole is helping control the infection, I don't want to throw it away. But if the liver is struggling, I want to protect it intelligently. If the dog can't tolerate fluconazole, I want to look at other options. And if no pharmaceutical is tolerated, I want a really strong holistic plan. And this is not about picking sides. It's about helping the dog survive and recover. Let me show you a link to my book. I actually wrote a book about valley fever. Let's see if I can find it. There it is. And I go over conventional treatment and holistic treatment for dogs. It's called Conquering Valley Fever, a tactical guide for dogs and their humans. And I actually go over some people stuff because I've got my story in there because I've had valley fever twice. It's not fun, by the way. I shouldn't laugh because it's not funny. Okay. So if your dog has valley fever and gets elevated liver enzymes, here's the big picture. Don't panic, but don't ignore it. Look at whether the enzymes were elevated before the antifungal was started. Look at how much they increased after. And look at the other markers, like bilirubin, not just the ALT and ALP. Look at appetite, energy, weight, pain, vomiting, bowel movements. You want to look at how the dog is actually doing and the overall trend. Are they doing generally better or are they doing generally worse with the elevated liver enzymes? We want to review every medication and every supplement, especially CBD, and we want to make sure the dog has meaningful liver support. Meaning, if they're on denamirin, we want to add some milk thistle to that to supercharge the denamirin. We want to consider whether the antifungal needs to be reduced in dosage or changed entirely. But don't assume itraconazole is automatically the safest next step. We want to consider broader options like posaconazole or voriconazole. We want to support the immune system. We want to feed a fresh food diet, use medicinal mushrooms and antioxidants. Use liver herbs based on your dog's pattern with the help of a veterinary herbalist to figure out that pattern, not randomly. Be cautious with detox until the dog is strong enough. And always remember, the infection itself may be part of what's stressing the liver. So this is why valley fever needs a multimodal approach or a multi-pronged approach. Fluconazole alone is usually not enough. Neither is denamarin. So we add milk thistle. We add mushrooms. We make sure they're on a fresh food diet. But when we stack all these therapies together, you can often make a huge difference. And the goal is not just to lower liver enzymes on a lab report. The goal is to help the dog get better, to control the infection, protect the liver, support the immune system, restore their appetite, reduce pain and inflammation, help them maintain or gain weight, and really give the dog the best chance of recovery. So that's why I combine conventional and holistic tools, because valley fever is too serious for a narrow approach. These dogs need more than a prescription and a recheck. They need a strategy. So if your dog has valley fever and the enzymes are going up, don't assume they're out of options. You may need better liver support, real milk thistle added to the denamarin, or to stop CBD temporarily. You may need to reassess the antifungals and consider posaconazole or voriconazole. You may need a stronger holistic protocol. And you definitely need a fresh food diet and medicinal mushrooms and antioxidants and antifungal herbs and the right liver formula. You may need to strengthen the dog before detoxing. And you absolutely need to keep monitoring. So if you're dealing with this right now, take a breath. Elevated liver enzymes are important, but they're not the end of the road. They're information. They're telling us the liver needs attention, protection, and strategy. The answer is not always to stop everything. The answer is to understand why the enzymes are elevated, how serious it is, how the dog is doing, and what tools we can use to keep fighting the valley fever while protecting the liver. That's the integrative approach. We don't ignore the labs or the drugs or the infection or the immune system. We put the whole picture together and build a plan that makes sense for the dog that we're looking at. So let me show you my online program called Rescue Your Dog from Valley Fever. It's actually a step-by-step program that helps you with an integrative approach for your dog that has valley fever, or even if you're suspecting your dog has valley fever, because it gives a lot of information on what valley fever is and what the symptoms look like and the things that valley fever mimics or masquerades as, because it gets misdiagnosed a lot. And I go over testing in more detail, and I go over all the supplements in more detail, and I have a custom herbal formula guide for each different variation of valley fever, because there are different supplements or different herbal formulas that you can use for different variations of valley fever. And I go into a lot of detail on that and help you choose all the right things to get your dog better. All right. So thanks for being with me. Thanks for listening. I'm going to be back next week talking about another common issue with dogs with valley fever and how to think about it and how to resolve it and all the specific things that you can do and things that you can talk to your vet about and collaborate with your vet so that your dog gets the best help possible and recovers from valley fever. Okay. Thanks for listening. I will see you next week.